As anybody who's followed the news cannot help but be concerned and dismayed at the situation in Flint, Michigan that has resulted in a public health crisis with really long lasting implication for those affected persons who live in Flint. And it's naturally raised concern around the country and certainly here in New Jersey that for our own water supply and our own water quality. I'm sure a number of you have over your career taken an interest in this issue. As many of you know, we passed out our committee a bill to regulate, to put an MCL on 123 TCP, which has shown up in high concentrations in the water supply of one of the towns I represent in Morristown. As I understand it, has been addressed by DEP and will continue to be addressed. And as I expressed in that legislation, I had concern that it's not just the town of Morristown, which may be facing difficulties with this. Any communities which were once farming communities with housing on it, any communities which once involved in industrial operations may see this particular contaminant in their water. And I, for one, I think the state should have a state-wide testing program on this because it is a known carcinogen and has been known to be so for some time. We also have the issues around lead, which are certainly in the news, and we want to make sure that we're doing everything we can to protect people from exposure to lead. And so I think I'm speaking for all of us when I say that that we have a great interest in this issue. You do speak to this question of as a charged term, environmental racism, but just the disparate impact of how that comes to people who live in poor housing stock, who live with poor resources to deal with these kinds of challenges, and have follow-on challenges that go out of control because of things like lead poisoning, which interfere with your ability to get the education you need to pull yourself up out of poverty in the first place. So it's really a scourge that we have to take on. And I would agree with the statement that we don't want to cause alarm. But it also is true that we do have problems and we have to take cognizance of them. There are issues about testing. The question is how frequent they are and then what's done with respect to notification of the public and what kinds of actions need to be followed up to make sure that there are remediation. The testing program that you're talking about, the actionable level, not every home is tested. There's a statistical analysis of that. Now, if your home happens to have lead in it, in fact, I was helping my dad with one of his houses in Bordentown. We were digging up. He had a lead water pipe going into the house. So there are issues around lead that we know that are spotty. That involve infrastructure, that involve things in the environment, that involve any number of things, and you've got to get at all the points. And the main thing is to find out what's happening at the tap, what's happening in the home, what's happening to the children who are being affected. When they do the testing, talking to the DEP, they are doing a sort of statistical analysis of what's going on in an area. Now, we have just heard that housing stock, if I've built on this block and my builder might have used copper pipe with lead solder, or somebody else might have used lead in another neighborhood. If you do spot testing, get a statistical overlay, your particular house may have an issue that won't show up in a statistical survey. Isn't that? That's got to be. So I'm concerned about that person who is not aware of the kind of pipe that they have in their particular home. How do we make sure that person, maybe you'll catch them by testing, yes, maybe not, but what do we do? How should we change our testing regime, our surveillance regime, to make sure that, because all of these things are devastating. You've got 10 people, that's, if it's $32,000 a year times 10, that's a lot of money. And worse than that is it's a life that might not very well reach its full potential because they might not get the $32,000, but you've done something systemically that's damaged that person. So what do you recommend that we do about those idiosyncrasies that are not going to be picked up in a testing program that necessarily does sort of statistical analysis that says generally things are such, But for myself or yourself, you now have a problem that's not picked up in the testing, so the action level isn't hit,
Right.
and now you're sitting there with an issue.
One of the things I think is important is to remind everybody that the CDC recommendation is 5. New Jersey's operating on 10. I think it's irresponsible for us to move forward and leave it at 10, and hopefully we'll do something about that. And if we're talking about water quality, you brought up trichloromethane, and most recently perfluorooctanoic acid, PFOA, is found in several places in New Jersey. New Jersey did fund a study in Ridgewood, New Jersey, up by us, I think $12 million, no, $1.2 million, I'm sorry. And this has been going on for a couple of years, and I think we need to see the results of the study and add these toxins to our list. And hopefully we'll be able to, as we talk about water quality, we'll be able to talk about newer, not really newer, this was a Teflon additive, but as these things crop up, we should add them and move forward and make sure that these aren't affecting our children. And I believe this is a crisis. If you're talking about 3,000 children in the state of New Jersey, if that were our children, I think we would stand up and run for the doors and make sure something happened.